Hi! October is Cancer Awareness Month, and this month I'll be bringing you a series of discussion about cancer. And today I'll be talking to Dr. Kinyanjui from Nairobi Hospice Hospital. So today we are going to talk about cancer screening, the importance, and measures anyone can take to prevent cancer. So let's learn.
In terms of screening, there are two modalities of screening. One is where the healthcare provider examines a woman's breast or a man's breast and identifies whether there are changes with that breast. So we'll be checking whether there is any swelling, we'll be checking whether there is any skin changes, and we'll also be checking whether there is any discharge. Before we used to delegate that responsibility to individuals, what we used to call self-breast examination. But we realize individuals keep on missing some of those key aspects, and why they need to emphasize that individuals need to go to hospital and get healthcare worker who are trained to examine their breasts as a form of screening. This is mostly recommended for people who are below 35 years. So they should actually be going for regular screening from a healthcare worker. For women who are 35 years and above, then what we advocate is for mammography. This is an investigation which looks like sort of like an X-ray. So the breast is placed in a surface, and an X-ray machine sort of passes the layers, and we're able to look at the image and see whether there are any changes on that breast. If there are changes, then what we do is then investigate further, and through taking a sample, what we call a biopsy, and investigate further and see whether there is any changes in that breast. So the two modalities for breast cancer is that you have a healthcare worker screening, and also you have the mammography for women who are about 35 years and above. And for individuals who are at higher risk, for example, you have family history of close relatives being diagnosed with breast cancer, we encourage these women or individuals to go for screening regularly, most if possible to do it on an annual basis, because their risk of getting the disease is usually higher than the common individuals. The screening helps in terms of detecting the disease in early stages. It also helps sometimes to identify individuals at risk and be able to guide them so that they can be able to put protective measures in place way before they get the disease. What we are trying to do as a country is to try and hold, because currently we have most of the patients, about 60 or so percent of the patients presenting to us when they're in stage 3, stage 4, which is already advanced stages. So we are not able to achieve cure. But if we change our lifestyle and we change our perspective and we go for screening, we'll be able to detect individuals in very early stages where the treatment will be less expensive, and we'll be able to have better outcomes in terms of cure. So yes, if you look at cancer in general, as you grow older, your risk of getting the disease gets higher, and we are seeing people who are probably 40 years plus. The risk of getting cancer is usually higher than individuals who are less than 40. Number two, people who have sedentary lifestyles. So people who use a lot of tobacco. And remember, for the youth, they need to appreciate that we are now sniffing it, we are chewing it, we are smoking it as cigarette, we are smoking it as shisha, and now there is even vaping. All those are tobacco products. And now I think even we are even chewing. So those individuals at higher risk. We are using those individuals who also consume a lot of unhealthy diets. So they put a lot of salt, they take a lot of fast foods, they take a lot of fatty food, and they end up with obesity. Their risk of developing cancer is slightly higher. Again, also people who don't engage in any regular physical activities, and which is very common now that we have improved in terms of transport. People use motorbikes, they take a matatu just from their doorstep and such. So again, also their risk gets higher. Environmental-wise, because again, there's also a lot of pollution. That's also putting a lot of individuals at risk. But also one of the things also I encourage people is also to look at their family history. Look at your great-grandmother, your grandmother, your parents, your aunties, your uncles. If some of those relations had cancer, then you need to raise as an alarm that you could have higher risk of cancer, because also cancer sometimes is also associated with genetics, where you'll be able to transfer from one individual to another through genetics. So again, those people who have family history then have a higher risk of getting the cancers. For the youth, we are so much carried by the hype, and therefore we want to do what our peers are doing, we want to do what the media is showing us, but we need to change that perspective and have very individual responsibilities. When you know certain activities or will put you at a higher risk of developing cancer, then you need to ask yourself whether you need to take that or not. For example, if you find in a group where people are consuming tobacco and you know the impacts of tobacco on your health, Why would you want to continue hanging around with such people? Because remember, it's not just primary smoking, but there is also secondary smoking where people are passing that smoke to you. So you need to take individual responsibilities, avoid the risky behaviors. And these risky behaviors goes even to sexual behaviors, because again, some of these cancers are associated with very risky behaviors, like the cancer of the cervix. If you have multiple sexual partners, the risk of getting the human papillomavirus are slightly higher and passing it even to your partner. So having that individual responsibility and making sure that you don't engage yourself in risky behaviors, you'll be able to reduce the chances of getting cancer. Not now, but even in the near future. But also urge the youth to support the people who are already affected with the cancer in the community. You could be living with a neighbor who is very sick and bedridden. What can you do as a youth when you have free time to support this individual? Could you help them with shopping? Could you help them with cleaning? Could you even go and help them even take care of their young children? That also would be also adding value to the affected communities and families.
Hope you've learned something. So like, share, and let's help one another. Till next time.